Okay, so finally, let's look at some heat waves. As you hear more and more now, with global warming, lots of the tropical countries and even mid-latitude countries like Europe, Russia, US are expecting more heat waves after big examples like the 2003 European heat wave, which killed probably some 75,000 people, the Russian heat wave in 2010, I think, which killed also thousands of people. Countries have become much more aware and have produced good heatwave warning systems, early action plans, and centers to protect people, and so on and so forth. There is, of course, data showing the outcome depends very much on the socioeconomic status, especially in a country like India. India experienced a very severe heat wave in 2013. 23 states and over 100 cities and districts across India are developing. The heat wave happened probably before that, but now since 2013, 23 states and over 100 cities and districts across India are developing and implementing life-saving heat action plans. The pre-monsoon season of India, before the monsoon, March, April, May, is the actual summer months of India, because when the monsoons arrive, things cool down, precipitation cools down in the country, and then it gets warm again a little bit before cooling because of the winter months. So during those days when the fields are being prepared and farmers are working outside and you get temperatures like this, you get lots of deaths, which is never a good idea. So India has developed now a very sophisticated system like this. This is actually, I'm recording this on May 21st, and this forecast is for May 26th or 7th. So it's showing regional, local scale information for watches, hailstorms, hot days, fogs, heat waves, heavy snow, ground frost, dust storms, warm nights, thunderstorm, lightning, dust raising clouds, cloud waves. And so you can see the categories range from no warning, watch, alert, and warning, to the symbols that say what specific hazard you can expect. And the system, of course, this is related to the heavy rain that's expected now from Cyclone Yas, which is headed straight into Odisha, which is sitting here, and they get hit quite often, and their cyclone preparations have become supremely good now, and the forecasts are very good as well. So this is a good combination of S2S forecast, health forecast like heat waves, and also other waterborne diseases and so on, and cyclone related heavy rainfalls. Okay. This is the Ready, Set, Go framework we talked about before. So there is taking seasonal forecasts and seasonal outlooks to get ready for seasonal risk. So review average heat risk across season, assess seasonal heat forecasts, assess seasonal forecasts, monitor weather forecasts, update heat action plans, review communication strategies, and so on. And set is the S2S time scale, weeks 2 to 4. Monitor weather forecasts more closely, recap emergency action plans, inform schools, inform cooling centers, reinforce coordination with disaster management personnel, and so on. And Go is the short and medium range, so days 1 to 10, let's say, where you begin to prepare utilities for increased power demand, prepare to open cooling centers, begin mass media public outreach awareness campaign, distribution of emergency drinking water, alert hospitals about increased demand coming up, reschedule hospitals staff shifts, check on elderly people, reschedule for sporting events, and so on. So this system is being implemented more and more formally, but also it has been informally considered now for a while. Thinking a little bit about implementation into the future, health data is a serious issue. Lots of people will tell you that this is a serious issue. So this is just a schematic showing how health information systems can be modernized, updated, going from old FTP file transfer kind of systems to new systems where data is collected at district level by facilities, so facility reports data captured and managed by the system, and there are web-based tools to make them available as data or as displays and fed to a national data warehouse, and their integrated analysis done with them, use and dissemination of information, and then sent to people on smartphones, apps, laptops, TV reports, and so on. And here you go from national collection district sheets to migrating historic data for historical analysis of the relations, for example, between diseases and environmental parameters, looking for predictabilities, looking for trends, whether a certain region is seeing more pathogens, more dengue, more malaria, and more heat waves, and so on and so forth. And also the idea of coming back to risk management. There is couple socio-ecological system approaches being taken to look at vector-borne disease hazards, for example, and compute vulnerabilities which depend on various factors, as I mentioned before, like per capita income, women's education, children's health, infrastructure, types of employment, access to information, access to hospitals, clean water, sanitation systems, and so on. And these are coupled together to manage risk, and so there are steps for adaptation on a slower time scale, vulnerability intervention, and hazard intervention. So you have to reduce the hazards themselves, for example, by controlling vector population, and vulnerability intervention, where you train people to understand warnings, early warnings, so you can overall reduce risk. And here the risk framework and its integration within risk governance, climate change adaptation, and associated intervention measures are shown in this framework here. So you're getting probability of an infective bite, so entomological inoculation rates, and so on. All data needs are driven by the system itself. And in 2.2 we are looking at domains of social vulnerability with illustrative examples. So biting exposure, again, general underlying factors, generic predispositions such as poverty, population change, and conflicts, which expose people to unhygienic conditions in emergency camps and refugee camps, and lack of access to doctors, hospitals, and so on. So lack of resilience, lack of capacity to anticipate, generic susceptibility, overall vulnerability, biological susceptibility, so preconditions, morbidities, comorbidities, lack of capacity to cope and recover. Even if an epidemic happens, not all groups have the capacity to cope with them and recover as safely and quickly as they can with a system that helps them. So here are clinical manifestations such as pregnant women, malnutrition, co-infections, and immunity. And here you go deal with coping and recovery abilities such as distance to clinics, health insurance, and so on. So you get the idea that we are going very far from just S2S predictions from the physical forecast systems, but going into socio-economic systems, socio-economic risks and vulnerabilities, and trying to develop this holistic management system for reducing risk to health impacts of weather and climate. Okay, so the co-benefits of that to economic development are obviously massive, and all the governments are now well tuned into it. Countries like India, for example, have invested heavily in improving their weather forecast, S2S forecast, and seasonal forecast, as well as their climate projections, and they are building these kind of risk management systems. So the last mile problems of transferring health early warning and heat early warning information to decision makers, as well as to at agency level and city level, administration level decision makers, to decision makers at home, like the head of the household or women who take care of the family or neighborhoods where there are NGOs acting as agents, and so on and so forth. So S2S will begin to play a bigger and bigger role in this Ready, Set, Go framework, and the skills are also improving for the environmental variables themselves, but also on translating them into usable and actionable information for health in this context, but also other contexts that we talked about before in terms of agriculture, water, health, and energy as well. Okay.